welcome back to Inside Healthcare. Joining us now is Diane Ness, who is a local TV personality and a cancer survivor. So thank you, Diane, for being with us.
Thanks for having me.
Why don't you tell us a little bit about your cancer journey?
Sure. On October 4th of this past year, I was diagnosed with what's called DCIS. It's ductal carcinoma in situ. It's within the milk duct. And that was after several mammograms. And then you wait and you have a biopsy. And then you wait again. And then they found out it was cancer. And I had surgery. In fact, Dr. Wallstrom, the doctor that was just here, was my surgeon. And he took it out, and then you have to let it heal. And then I met with my radiation oncologist, Dr. Cameron, and we discussed the treatments. And then I finished my treatment, which was radiation, on New Year's Eve.
Wow, what a great way to celebrate the new year.
It was. But I think, Jody, one of the things that I wanted to talk to you about that I spoke to my oncologist about was that early detection. When DCIS first shows up, it's a grain of sand. And because I went in yearly, they had stacks of mammograms from myself. And they were able not to see it, but to compare. That
something was different.
Something was different. And you can't see a grain of sand. You can't feel a grain of sand. Had I let it go a year, my oncologist said it would have been a lump. And at that point, I had stage 1. But at the point that if you let it go, it can go to stage 3 or 4, and then it's too late. So if you catch it early, which I didn't think I had anything, it was just my yearly physical and mammogram, and lo and behold, it was cancer.
Yeah, and it seems like we've gotten conflicting studies in recent years saying, you know, well, women, it doesn't improve your odds or reduce your risk.
Yes, ask me.
Yeah.
It does. I would be in much not as good shape as I am right now. I had it taken out. I had the treatment taken care of, and I'm here to talk about it. And I truly believe in early detection. I know there's arguments for that too, but talk to a cancer survivor, and they'll give you a different answer.
It's not only a physical thing, but it's such an emotional thing too.
It was such an emotional journey. And the waiting was the toughest for me. I tried to stay busy, but you basically wait a week in between each procedure. And that is, you think the worst. 3 o'clock in the mornings are not fun. Fortunately, I had some really great doctors that said, in fact, the radiation oncologist said that, what are you afraid of? And, you know, we would talk, and she said, this is 100% treatable right now. So they ease your pain. But absolutely, most of it is the emotional journey that you take.
You were saying that you wish you knew what you know now, you wish you would have known when you first started this whole journey.
So my first day of radiation, I was a basket case, and we talk about it later. The radiation oncologist and myself talk about it later, and we laugh. We can laugh now because I was such a nervous wreck. You don't know what's behind door number 2 or door number 1 when you walk back to treatment. It's frightening. It's terrifying. It's a very big, thick door, obviously, so that the rays don't go outside of that room. And I had never seen the machine, which is large. But if you've had children, you've had to go through, you walk through the hospital and the labor and delivery room, and you see movies and you know what you're in for. And I talked to her about that, and I said, I didn't know what I was in for. I was terrified. Why can't someone someone have a movie out on it? Or I even volunteered to go reenact what it's like. Because really, Jody, it's just a very large x-ray machine that comes down on you. And it was so simple. It didn't hurt. It basically was a time. Every day you have to go at the same time. But it basically took 7 minutes of my life every day.
But 5 days a week for how many
however many weeks they decide that you're going to have that on. It's an inconvenience in time. But I didn't know that the first day. And you lay there, and I felt like I was going to hyperventilate. I felt like I was going to...
Well, and you are in the room by yourself, but you can
yes,
hear
you
the
are
voices
by yourself,
of the
and you hear them outside. And I think if I'm a visual person, and if I could have seen that beforehand, it would have really eased my worries a lot. And then I was, throughout the whole cancer, I didn't want to talk about it. I just wanted to move on with my life. And that's a struggle too. You know, my daughter kept telling me, you need to sit down and talk about it. And I'm not a talking about feelings kind of person. I had, when I had my biopsy, which was slightly painful, I had it at 10 in the morning, and I was on the ice at 3 o'clock in the afternoon teaching skating, which is what I do. And my son, who I love dearly, couldn't go to work because he couldn't function.
Your son.
So each person handles it differently. I had to stay busy. I had to try to not think about it.
Yeah, because not only are you going through it, but everyone that you know and love it has different experiences.
Right. And at first I had a very small circle of people that knew about it. I didn't say anything until about 6 weeks in. My family knew about it, and the very close people that I worked with knew about it, and that was it. Then I started to relax about it, and I started to learn more about it, and like you said...
Oh, you even contacted us to say
right.
you want to let people
know.
Now
I know more about it, and I went through it. And now I want to tell people that are in the midst of that it's, you know, do research on it. It's not as terrifying as you think. As my doctor put it, it's not a death sentence. Just figure out the route you're going to go, learn about it, try and see ahead of time what you're in for, and go to the treatment center and look, and then that will help.
Well, it's been a pleasure to have you with us, and
thank you.
Thank you for sharing your
Thank
story.
you.
And I know this isn't the end of it. You'll be doing more, trying to let other people know about it. So.
I hope if one person is less terrified, then I've accomplished something.
All right. Thanks, Diane.
Thanks,
Appreciate
Jody.
it. And we appreciate you joining us. We hope you'll join us next time on Inside Healthcare. Thank you, everyone. See you then.
Is it too long?